Yeah, ladies and gentlemen, welcome fellow viewers to my channel, Dr. Haringi Etebo, expert in medical biochem and therapeutic medicines, PhD. Yeah, welcome once more. I'll be talking this time around about 5 very important tests, medical tests that you need to carry out, routine tests that you need to do if you are an adult, irrespective of your race, your sex, your height, your size, your personality. Now, we have some certain tests that I'm going to list out, and I'll elaborate briefly on each of them. The first test that I'll be talking about is your blood pressure. Blood pressure is, in simple terms, is going to tell us, it means that we are going to check the force that your blood is exerting on the walls of your arteries, where blood is passing inside your body, like you call it vein in common language. There's a force that the blood is exerting, is pushing towards the walls of that capillary that is carrying, or the vessel that is carrying, or the artery that's carrying or transporting blood. Now, what are we checking? Why is it essential to check the blood pressure? It's because we have to know our status when it comes to the disease we call hypertension, alongside the heart pulse rates, because the machine, the sphygmanometer, is a machine that is generally used for checking blood pressure. Now, when we are checking your blood pressure, or when you are checking your blood pressure, usually a normal blood pressure rate, standard rate, is 120 on 80 millimeters per mercury. There are two values you usually see when you are having the readings. The first value is up, the one up, which is the numerator, is called the systolic value, is 120. That's average or standard value. And the one that is in the denominator, the value below, which is 80, is called the diastolic value. So we consider that it's lower when your diastolic value, the one below, is below 60. We say your blood pressure is low. And when the systolic, the value above, that one that's 120, where it goes below 90, we say that your blood pressure is low. We call that condition of low blood pressure hypotension. You are hypotensive. Now, when a person or an individual is having a blood pressure approximately 135, the value above, to 140, we say that kind of an individual is pre-hypertensive. You are about to become a hypertensive patient. And those within the range of 140 to 160, we classify them as primary hypertension most often. And those within 160 to 180 are considered as patients of secondary hypertension. Those are the two main forms of hypertension. Now, the reasons you have to check your blood pressure regularly is because different factors can cause it. Most often people have a misconception that blood pressure is caused by witchcraft, is juju, in simple or other words, or hereditary factor mainly. No, I would say no. There are so many factors. Like you watch my other previous videos, I've explained that pregnancy alone can cause somebody to become hypertensive. You can have an autoimmune condition, it will cause you hypertension. You can have a condition like severe or acute malaria without knowing, and you're not taking treatment, it can elevate your blood pressure. So it's always essential that you check, you have a routine check. A blood pressure check should be something that is a routine check regularly. That's why it's a basic necessity to have the blood pressure machine at home. It's not luxury. Secondly, we also have to look at the heart pulse. Most medical personnel or healthcare workers always concentrate on, or they pay attention but to the hypertension reading or the blood pressure reading, and neglect the pulse. Pulse means the heart rate, how many times the heart is beating within a minute. which should be approximately 72 beats per minute for an average or adult who is not an athletic. That is a standard rate for heartbeats. But it's best when it's between 60 to 72, approximately 64.5 and 66. They are very good heart rates for individuals without considering extreme circumstances like excessive physical activities like with bodybuilding, athletics, and all that. Now, we should note that the heart pulse, when it goes below 50 beats per minute, it's a symptom of bradycardia, meaning that this individual is going to have a condition, have a condition known as bradycardia, which means a weak heart pulse rate. And when it exceeds 100, we can easily get to a condition we call tachycardia, which means that the heart rate is high, severe. So we have to, the pulse rate, the heartbeat rate is severe, is high. So we have to investigate their respective reasons, because those two extreme levels or heartbeat rates or number of times their heart beats, that's the pulse, we consider it to possibly lead to a heart disease. Now, the second thing we have to check after the hypertension or blood pressure rate is the blood sugar. Blood sugar can be checked in three ways. The first is fasting blood sugar, which should be is between 70 to 110 milligrams per deciliter of blood. It means that when you have not eaten, we call that fasting blood sugar, you have not eaten anything or taken any medication, your blood sugar should be within that range. Sometimes it varies depending on the machine, the strips that they are using. But standard should be between 70 to 110. It's best between 70 to 100 because most people between 100 and 110 milligrams per deciliter of blood sugar reading, they are sometimes, majority of them end up becoming pre-diabetic. So with that, more is elaborated when I explain in my diabetes video where I talk about type 1 and type 2 diabetes, and possibly type 3, which is linked to Alzheimer's disease. Now, I will also elaborate on the fact that there is a second way of checking sugar apart from FBS, which is fasting blood sugar. That's RBS, random blood sugar comes in. It should be checked even when you have eaten. It can be checked by the medic or the lab scientist or technician. That can range between 130 to 180 milligrams per deciliter of blood, depending on the strips that are using. It also gives a guide, because if you have eaten, they check your blood sugar is about 200, 190. It calls for concern where further investigation should be done, or even 150. It calls for concern, because when your system metabolizes carbohydrates, breaks down sugar or starch very well, it's not going to allow you to have extreme or very high values of blood sugar level. Thirdly, we have HbA1c, which is given, is a measure that is good to do that routine. It's a routine sugar test that you can do after every 1 to 2 years. That one should be done after 1 to 2 years. It gives an average of your sugar for the past 3 months. That one should be done is a check of your glycemic index level, or in terms of your blood sugar, average blood sugar for the past 3 months. That will guide us to know if you are pre-diabetic or you are diabetic already, whether you have a high probability of having diabetes in future or you're already having, but the values are not coming up visibly regularly in blood fasting sugar or random blood sugar test. So it's always good to go for these routine checks. And we have the glucometer, which is the blood sugar machine. It's always good to have that. Those are things you don't get them only in medical facilities. Each family should have. It is a necessity that you have that. You check that at home, especially grown-ups. If you are 40 as a male or 30 as a female, especially with our society today where there's a lot of carbohydrates and sugar in our diets and in our foods, fruits and beverages, we have to try to make sure we monitor blood sugar levels very well, because diabetes comes as a result of insulin resistance or autoimmune condition, those can come up due to sugar elevation. Take note that consuming cube of sugar will not cause diabetes directly. That's the wrong conception. Many people think they run from sugar, they eat bread, fufu, gari indiscriminately, not knowing that those have sugars, they can cause you sugar spikes far more than the cube of sugar itself. Now, I will talk the third thing that we have to check is cholesterol. Cholesterol is referring to your blood fats, the fat that is found in your body, your blood particularly. We have LDL, which is low density lipoprotein, the bad fat. We have HDL, high density lipoprotein, which is the good fat, as we for simplicity reasons. And we have triglyceride, which we also have much in. We commonly find them in our oils, our cooking oils, and it's another form of fat that's in the blood. That is checked in a certain test we call the lipid profile test. When you go for that test, they will examine you. They will get blood sample and analyze it in the laboratory and deduce if you are having high levels of the LDL. Normally, the LDL is the bad fat, while the HDL is the good fat. Under every circumstances, the good fat should always be better than the bad one. When the bad fat is higher than the good fat, even if the values are not above the standard values, which are considered as high LDL or HDL, it is not too advisable for that person to be without supervision or control by a medical expert. That's why it's essential to see a medical doctor when you are sick, because they will understand this better than the person you just meet. He will prescribe you medication. And this comes up with people who go for weight loss. You go and take some wrong therapies for weight loss that will cause you harm. So we have to always meet experts when we have health challenges. Another aspect I want to call your attention to is triglycerides in your cooking oil. Avoid bleached palm oil, avoid bottle oils where you have not read their labels. Most of those labels don't have accurate information with respect to what the content is. Some companies put those tags on information on the papers you find behind their products for publicity reasons, especially in a country where you don't find a good supervisory board that investigates their products. Now, I'll go to the next point, which is kidney and liver function test. That is a test that is very essential for a different category of persons, particularly those who are on drugs, like those who are taking regular medications in diabetes, hypertension, HIV. Those persons should do routine checks at least every 6 months. They should go for this control, because it gives us analysis on how healthy the liver and the kidneys are. But those who are not on drugs can do the test. We say routinely, if you are between 30 and 35 years old, you can do this test after every 2 years. It's not bad if you do it after every 2 years. But if you know that you are into alcohol, you are into cigarettes, you are into heavy quantity of protein consumption, you love eating beans, you love eating meat, beef, eggs much, you have to do those tests regularly after every 6 months to 1 year duration. It is very important, because if you neglect that, you might have severe condition with those organs that are related to the test, and probably if it's not diagnosed in time, you can have complications in treatment procedure. Finally, I will talk about the fit test is cancer and some infections. Yes, cancer is something which should be checked for most often. Not the medical books will tell you that from 40 years onwards. It's wrong. There are children these days that come up with cancer who are less than 20. Based on the fact that we have a lot of poor feeding habits, junk foods, many children, especially children who they call themselves or their parents or society classify them as Ajebo kids, they have to go for routine cancer screening, irrespective of their age. We should not always think that everything should have standards. The aspect of standard, those are things that should be kept in textbooks, because practically in the field, I've seen children who are having hypertension at the age of 16, who measure heart diseases at the age of 20. Why is this happening? Because of the bad lifestyle. You feed on junk foods. You are exposed to such diseases, cardiovascular diseases. You are exposed to cancer. The children, you give them ready-made foods, supermarket products, all foods in containers, they can provoke cancer. Human papillomavirus can lead to cancer. We have to check, and though not all the HPV will cause cancer, there are some strains that majority of the strains will not cause cancer. But it's always good to check. But more, those who are to check most are those who are HIV patients, especially those who don't take their medications regularly. Those who have already been diagnosed with human papillomavirus should go for routine cancer screening. Those who are also exposed to chemical substances like body lotions, bleaching agents, you rub body lotions, rubbing oil that, in quotes, that you apply on your body that bleach you should go for cancer screening. Because as you take creams, you take lipstick, you take nail polishes, those chemicals get into your blood and stay in you. And those are the things that contribute to cause cancer. Not leaving out those who are staunch smokers, cigarette smokers, and heavy alcohol abusers. If you abuse alcohol, you are also in that category of those who are supposed to do routine checks. Now, as the diseases that we have to check routinely, being an adult, when you're already into sex particularly, you have some certain diseases, though not only sex, you can have these diseases. Most of them are classified under STDs, sexually transmitted, but some of them can still be acquired, like through blood transfusion or sharing of needles, like hepatitis. You have to check hepatitis B and hepatitis C. You have to check HIV. It's good to also check syphilis. Men are supposed to go 40 or 50 upwards. You go for routine screening for prostate and PSA. You check your prostates regularly in an interval of 2 years. It's very essential. Women should go for routine ultrasound, especially pelvic ultrasound, when you are above 40 upwards. And those who have exceeded 5 years without having children, it's good to check. You do abdominal pelvic. It's the check, especially a pelvic ultrasound, is very essential. So I'll advise you to get the necessary instruments that will help you to do this routine test. For those of you who have challenges acquiring them, I think I have good contacts that can help you. But in good medical vendors, you can find sphygmanometer that we use to check blood pressure, especially the one that's electronic for easy readings. And we also have the glucometer. It's also sold in good pharmacies for blood sugar. And sometimes I'll advise you to go get the pulse oximeter so that you know your oxygen saturation, for those of you, especially those who have cough or lungs related diseases. And if you are getting towards 650, 60 upwards, it's also good to have the pulse oximeter. Not leaving out a scale to check your weight. You always check your weight in the morning. It's very good to check so that you know if you are becoming underweight or you are becoming overweight. Note that overweight depends on your height. It's not just about looking the size of somebody and say this person is fat or is large. You know, your size should be commensurate to your height. When it's not, that's when we say that you are overweight. And when you exceed overweight, we say that you are having obesity. And note that overweight and obesity leads to what? It leads to cardiovascular diseases and many other challenges. Thank you for watching this video. If you find it educative, please don't forget to press the share button and also a like and subscription button for those of you who are not having who have not yet subscribed to my channel. You can subscribe so that you have access to my other videos. For more information, you can contact me through my cell number 678081988. I repeat, 678081988. And the second number is 681446125. 681446125. Both numbers have WhatsApp. And if you have access to my 3 names, Harry J. Tebo, you have access to my videos just like those who have subscribed on this channel. Thank you and have a nice day. Bye-bye.